Gestational Diabetes by Tina, Melissa, and Vera. Gestational Diabetes by Tina, Melissa, and Vera. What is gestational diabetes? It is diabetes that develops during pregnancy, either onset or initial diagnosis. It usually only lasts while the mother is pregnant or during gestation. It appears around 20 weeks gestation. The exact pathophysiology is unknown, but insulin resistance plays a large role. The cells of the body fail to respond to the hormone insulin as they normally do. Pregnancy hormones, including progesterone, estrogen, and cortisol, disrupt insulin's usual reaction of binding to its receptor, causing interference with cell pathways. Insulin regulates glucose levels. Muscle and fat tissue cannot absorb the glucose from the bloodstream, so glucose levels remain high, equals more glucose to the baby. Testing and screening. For the average risk pregnancy, screening is done around 24 to 28 weeks gestation. High-risk mothers can be screened at their initial prenatal visit. The mother consumes a sugary glucose drink at her prenatal visit. The blood is drawn 1 hour later. If mother fails this test, a 3-hour glucose tolerance test may be performed at the discretion of her medical provider. Risk factors of gestational diabetes include minority groups, specifically Hispanics and Indian Asians, those with a history of gestational diabetes with their previous pregnancies, obesity, advanced maternal age, low socioeconomic status, those with a lack of prenatal care, a strong family history of diabetes, or glycosuria. Risks to the mother include preeclampsia, increased risk for infection, ketoacidosis, hydramnios, dystocia, retinopathy, urinary tract infections, mononeural vaginitis. Risks to the baby include macrosomia, increased risk of a C-section birth, perinatal mortality, congenital anomalies, respiratory distress syndrome, or intrauterine growth restriction. After the diagnosis of gestational diabetes, the mother is instructed to test her blood sugars as directed by her physician, usually fasting and 2 hours postprandial. Most cases can be dietary controlled, but the mother may need to be started on medications, either oral agents or insulin. She may be referred to a dietitian or a diabetes educator for education and teaching. Mother is encouraged to exercise and limit her weight gain, as mom only needs an extra 300 calories per day with gestational diabetes. Some important extras about gestational diabetes. Mothers of African American backgrounds are more likely to develop postpartum hypertension if they had gestational diabetes. Gestational diabetes affects up to 12.3% of all pregnancies, and prevalence is on the rise. MNT, or medical nutrition therapy, is the cornerstone of management, adequate calories and nutrients to support a healthy pregnancy. Most mothers with gestational diabetes will have normal glucose levels by 6 weeks postpartum, but the risk is higher of developing type 2 diabetes within the next 5 to 10 years. Mothers with type 1 diabetes may actually have lower glucose levels early in their pregnancy. Nursing diagnosis: impaired nutrition, less than body nutrition related to decreased insulin production and glucose uptake in cells, manifested by high blood sugar readings. Interventions: provide education on importance of compliance of diet and exercise, monitor and record blood sugar readings, and take glucose log to your prenatal visits. Refer to dietitian to assist with meal planning. NCLEX question number 1. A 39-week gestational client is in labor and ready to deliver. Mother has gestational diabetes. During pregnancy, the client missed several prenatal appointments and admits she has not been checking her blood sugar. Which of the following are risks to the infant as a result of her uncontrolled gestational diabetes? Select all that apply. A. Macrosomia. B. Low birth weight. C. Hyperglycemia. D. Hypoglycemia. Or E. Increased risk of obesity later in life. The answer is A. Macrosomia. D. Hypoglycemia. And E. Increased risk of obesity later in life. Rationale is gestational diabetes results in increased risk of macrosomia due to excess glucose levels in the blood, hypoglycemia due to no longer being connected to the mother's blood supply. Infants born to mothers with gestational diabetes are at risk for being obese later in life. NCLEX question number 2. The nurse implements a teaching plan for a pregnant client who is newly diagnosed with gestational diabetes. Which statement made by the client indicates a need for further teaching? A. I should follow a diabetic diet. B. I should check my blood sugar at home. C. I should avoid exercise because of the negative effects on my insulin production. Or D. I should be aware of any infections and report them immediately to my healthcare provider. The answer is C. I should avoid exercise because of the negative effects on my insulin production. Rationale is exercise is good for clients with gestational diabetes to help maintain glucose levels along with diet control.